Still on the Rcgp case cards. This one says, explain tension headache to an anxious 33-year-old woman. The first thing to understand is that your headache isn't caused by anything worrying or life-threatening. This does not mean it is less painful, and we can sort it out. Tension headache is the most common type of headache. The cause is often not clear. But for some people, it can be caused by stress in their life. Sometimes it is due to tension in the muscles of your scalp or neck. Some people seem to have triggers for their headache, such as caffeine, alcohol, certain foods, or tiredness, that's fatigue. If you take a lot of painkillers to help with your headaches, these can lead to further headaches. So we need to keep an eye on what you are taking and how often. Let's not forget, there's something called MOH, medication overuse headache, which typically happens when a person has been consistently taking painkillers for up to 3 months or longer. If it's paracetamol or ibuprofen, typically the person will be taking it for up to 15 days in a month. If it's stronger painkillers like opioids, the person typically will be taking it for up to 10 days in a month, for up to 3 months or longer. Let's continue. There are many things that may help, such as relaxation, yoga, exercise, meditation, or massage. Painkiller-wise, it's best to start with simple things you can buy over the counter, like paracetamol or ibuprofen. Come and see me if these aren't enough. It's good to look at what makes them happen so you can learn to avoid your triggers. A headache diary can help. So symptom diary is something that is so vital in patients' education. If it's something that's been going on, keep a diary and write down the time and date when you have that symptom and things that may have happened around that time, what exactly you were doing, and anything, maybe any particular food, any particular exposures that you may have come in contact with that may be contributing to those symptoms. Keep a note and let's see if there is a pattern. The next Rcgp case card, this one says, explain a new diagnosis of eczema to the mother of a 3-year-old patient named Harry. The itchy red rash on Harry's elbows and behind his knees are typical of eczema. The skin is dry, angry, and inflamed. This makes it itchy and triggers an itch-scratch cycle. Scratching will make a flare-up last longer and can cause infection. The main treatment for flare-ups is a steroid ointment to dampen down the redness or inflammation. We usually start with a weak steroid, but sometimes need to use stronger ones if it doesn't settle. Once the inflammation has settled, flares can often be avoided by using moisturizers as frequently as possible, which I can prescribe for you. Nobody moisturizes enough. Be generous. You can never use too much. It's about finding the right cream for you both. If Harry doesn't get on with this one, let me know and we'll try a different one. Let me plug in my device. I think my battery is low. Just a minute. It's important to understand how much steroids to use. Too much often will thin the skin, and too little may be ineffective. We use fingertip units to explain how much to use. 1 unit is the amount of cream squeezed out from the tip of an adult's finger to the first knuckle crease. I'll give you some information that has a picture of the fingertip unit and explains the amounts to use in more detail. Things that can trigger eczema include perfumed soaps and bath products, stress, some foods and fabrics. Keep a diary. Keeping a diary could help work out Harry's triggers. Again, symptom diary. When does he have a flare? What has he come in contact with? What has he eaten? Let's see if there's a pattern. Let's see if we could identify something that could likely be contributing to these eczema flares. When you identify something that you suspect, then you can do a targeted allergy testing to actually find out if the child is allergic to that substance or material or food. The next Rcgp case card says, explain acute onset stroke to the son of a patient you've just admitted. I've sent your father to hospital because I'm worried he's had a stroke. There are two types of stroke, a bleed in the brain or a blood clot, which stops blood flowing to the brain. Both can cause injury to the brain, preventing it from working so well. Strokes are usually caused by high blood pressure or an irregular heartbeat. In hospital, your father will have a brain scan to confirm if he has had a stroke. He will also need some blood tests and a heart tracing. If the brain scan is done within 3 hours of the symptoms starting and it shows a blood clot, a clot buster medication may be used to break it up. These can reduce the amount of damage to the brain and help recovery afterwards. So the clot buster will be the fibrinolytic agents, okay? The fibrinolytic agents, like out of place. Your father will be seen by lots of people once the stroke has been confirmed. Speech therapists will want to see him to check he can swallow properly and help with any speech difficulties. Physiotherapists will help with any balance or movement problems. An occupational therapist may also be needed to make sure he can manage with everyday tasks, especially once he is ready to go home. The medical team will try to find any underlying cause for his stroke and will look into preventing further strokes from happening in the future. When he comes home from hospital, we'll come and visit him. So a home visit, we'll arrange a home visit. This statement, if the brain scan is done within 3 hours of the symptoms starting and it shows a blood clot, a clot buster medication may be used to break it up. I think 3 hours, is it not 4.5 hours, isn't it? For anticoagulation, anti-fibrinolytic therapy. And then it's up to sometimes within 9 to 12 hours you can do thrombectomy. So the window for thrombectomy is usually longer than the window for thrombolysis. I would need to double check that duration. I think it's 4.5 hours. Okay, or is it 4.5 hours for myocardial infarction? Okay, let's go on. Sometimes numbers are difficult to remember, you know, so many numbers. That's why we have algorithms on the word, so you can always pull out your algorithms and run it through in cases of emergency, just so you're not doing things that are a bit vague in your memory. So, the next Rcgp case card. It says, discuss the causes of erectile dysfunction with an otherwise well 65-year-old man who is not diabetic and takes no medications. Almost all men experience some difficulties with an erection at some point in their lives, most commonly if they are tired, stressed, or distracted during sex. If this is a frequent problem, it's called erectile dysfunction or impotence. Broadly speaking, there are two causes of erectile dysfunction: psychological and physical. Most men will have a combination of the two. After all, it's much harder to get an erection if you are worried that you are not going to be able to. It often starts due to a loss of confidence or purpose. For example, following redundancy or retirement. Stress, anxiety, depression, or relationship problems can also contribute. If you think any of these are an issue for you, there's a lot that can be done to help. Sometimes we need to refer men and their partners to a special sex counselor to talk through the issues and discover possible solutions. Don't forget that too much alcohol can cause erectile dysfunction too. One of the most common physical causes is narrowing of the blood vessels in the penis, meaning there isn't enough blood flowing into it, flowing in to cause an erection. High cholesterol, high blood pressure, and age can all make this process worse. So we need to keep an eye on these. The next Rcgp case card. Explain carpal tunnel syndrome to a pregnant 37-year-old lady. The wrist is made up of several small bones called the carpals. Between these bones is a narrow channel called the carpal tunnel. An important nerve runs through the tunnel, which allows you to feel and move part of your hand. If the pressure in this tunnel builds up for any reason, the nerve can get squashed, resulting in pain, numbness, or tingling like you are experiencing. This condition is common in pregnancy due to generalized puffiness or swelling, and often resolves once the baby is born. In the meantime, there are things we can do to help your symptoms. Try not to use your wrist more than you have to with squeezing, twisting, or wrangling movements. You can try using paracetamol if the pain is really getting you down. You might like to try a removable splint on your wrist, especially at night when the symptoms tend to be worse. If none of these are working and it's really making you miserable, we could consider a steroid injection into your wrist, which helps reduce the swelling. So the steroid injection, because it's a topical, first, steroid injection is safe in pregnancy. But it's always good to double check on your BNF, any medication before you prescribe any medication, either systemically or locally in any patient who is pregnant or breastfeeding. It's always good to double check. The last Rcgp case card for this session, this one says, discuss end-of-life preferences with a 75-year-old man who realizes he is dying from metastatic prostate cancer. Although it can be very difficult to talk about dying, it's important for us to discuss some of the things you may want for yourself as you are nearing the end of your life. That's quite a sad discussion to have with a patient, in all honesty. It's quite a really difficult and sad discussion to have. You may feel it's important to discuss where you would want to be when you die, who you want to be with, if anyone, and whether you want to be cremated or buried, as well as the more obvious things like your will, which a solicitor can help you with. You might want to be at home when the time comes, but you may prefer to be in a nursing home, hospice, or somewhere else. We will do our very best to make sure you are where you want to be. But be reassured, doctors, nurses, and carers are able to look after you wherever you choose to be. If your symptoms, like pain or breathlessness, are very bad, a hospice might be the best place to be, as they are specialists in improving symptoms. Many people go into a hospice to have their symptoms controlled and then go home again. Going to a hospice doesn't mean you have to die in a hospice. It's important to discuss your thoughts and feelings with your family and friends so that they are on board and can help make decisions if you are not able to. Cheers, guys.